Good morning, everyone, and welcome to another Health Ministries presentation on breast cancer awareness. This is such an important topic for all of us as we can share it with our friends, our neighbors, our family members, especially for the African American community and Hispanics, as we are the ones who die the most from breast cancer. And there are so many new advances that will save our lives. So today, Dr. Williams Olango will be with us to present on breast cancer. Let's open up with a word of prayer. Father God, thank you so much for all that you have done for us. Thank you for bringing Dr. Olango to share with us this important information. Help us to understand, open up our minds to hear everything that she's saying. Please bless her family and for her willingness to come and join us. And then also, please help us to retain the information and put it to use for your glory. In Jesus' name I pray, amen.
Amen.
Now, Dr. Jacqueline Williams Olango is a board certified OBGYN who did her training there at Loma Linda University and her residency at Baltimore. Currently, she is practicing in Bakersfield, California. Please welcome with us Dr. Olango.
Good morning. Thank you for having me on this early Sunday morning. I appreciate the invitation from the Kansas Avenue Church, and I hope that this information will be useful for you and something that you can share with others. So what I try to tell my patients in general when I'm giving them information is I want you to use your brain like a colander or a sieve, whatever you want to call it, a strainer. What you need, don't have to keep, hopefully there will be in all keep. So we're going to positive note. So with breast cancer, there are over 3.1 million cancer survivors in the US, and survival continues to climb due to better treatments and increased screening. So let's talk about the breast. So breasts come in lots of different shapes and lots of different sizes. And so it doesn't matter what they look like to you. When we peel the skin away, all breasts look the same. So under there, you have segments. They're about 15 to 20, and they're called lobes. And the lobes are further broken down into lobules. And lobules are further broken down into little bulbs. And that's where the milk is synthesized. In addition to the lobes and lobules and ducts, you have ducts, sorry. And ducts are the tubes that transport the milk. On the other side of the picture, you'll see the little green circular items. Those are lymph nodes, and lymph nodes drain infection. They also try to fight off cancer when it's there. And the lymph nodes run along the side into your axil or armpit and up to your clavicle. So when you're getting a breast exam in the office, the doctor may actually touch just above your collarbone because they're checking for lymph nodes. Okay? Now that we know the anatomy of the breast, let's talk a little bit more about breast cancer itself. So ductal cancer is the most common form of breast cancer, and 1 in 5 of newly diagnosed breast cancers are the ductal type. Lobular cancer is more often found in both breasts, and a woman can actually have non-invasive or localized lobular cancer on one side and have invasive on the other side. Another less common form is inflammatory breast cancer. This is rare, but it's aggressive. With inflammatory breast cancer, what typically happens is the lymph vessels get blocked and you have redness and swelling and skin changes in the area. And so you don't have actual palpable mass, you have skin changes that are very prominent. Carcinoma in situ is when the cancer is localized and it hasn't spread anywhere. So leading risk factors. The number one risk factor for breast cancer is being a woman. So once you have 2X chromosomes, your risk is higher. And getting older actually is also an issue. So men can get breast cancer, but the risk for women getting it is 100 times greater. Hereditary breast cancers only make up about 5 to 10% of the cases, and the most common hereditary forms are due to BRCA, so BRCA. BR stands for breast, CA stands for cancer. So BRCA1 mutations or BRCA2 mutations. Women with BRCA1 mutations have about a 55% chance of developing breast cancer at some point in their life by age 70, and women with BRCA2 mutations have about a 45% chance of developing breast cancer by the time that they're 70. So where does this all come from? So actually, the BRCA genes are there as tumor fighters. So in the body, they exist normally to help prevent prevent cancer from forming. When an individual has a mutation, what happens is these genes no longer do what they're supposed to do, and so the cancer goes unchecked. So women who have this particular mutation inherit it, as mentioned before. If you have the BRCA1 mutation, your risk of breast cancer, ovarian cancer, pancreatic cancer, and prostate cancer in your family is higher. So if you were to have a family history of several men with prostate cancer and one woman with ovarian cancer, you'd be someone who definitely would want to get tested. For women with the BRCA2 mutation, the risk of breast cancer is still there and prevalent. Ovarian cancer is prevalent, melanoma, pancreatic cancer, and prostate cancer. So especially with pancreatic cancer being such a deadly cancer, if that is found in your family, genetic testing should be something to consider. So going to another thing that we may see come up when it comes to breast cancer, this is just informational. HER2. So HER2 stands for Human Epidermal Growth Factor Receptor. And basically, this particular protein is actually found on breast cells. But for people who make extra genes for this protein, you'll find it more so in certain breast cancers where this is proliferating, and because this is proliferating and causing more aggressive breast cancers because the genes are turned on to make more abnormal cells. So this is just what I mentioned before for people who are HER2 positive. Some women have higher levels of the protein, and so that's why their cancer tends to grow faster. And so if you were to speak to your doctor and he or she were to say that you have a HER2 positive tumor, the treatments would be targeted to this specific cancer. So triple negative breast cancer. So whenever you have a tumor, the receptors are checked for estrogen, progesterone to see if there's the HER2 there. This is a very aggressive type of cancer, so that's why they're checking, because once they know that this is there, the treatments will be designed for this type of cancer. Unfortunately, though, this happens in younger women, and it's more common in African American women. So breast cancer facts, things that we hear all the time. So non-Hispanic white women have a higher rate of breast cancer incidence. However, in African American women, the diagnosis is higher before age 40, and we're more likely to die from breast cancer. So there's research being done to figure out why is it that we are actually more at risk for having breast cancer at a younger age. And having this information, though, should hopefully allow women to be more proactive with doing self-breast exams, and also talking to their physician about starting mammograms before 40, depending on their family at risk and their risk. So with all this information, what can I do? What are the things that I can control? So check your breasts regularly, abstaining from alcohol, maintaining a healthy weight, breastfeeding if you can, and speaking with your doctor about screening for genetic mutations. Those things are very important. So when you do a breast exam on yourself, sometimes we focus on basically just the touching part of it, but actually your breast exam should also focus on looking. So you want to stand in front of a mirror, and when you're in front of the mirror, you're going to want to put your hands on your waist, so hands on your hips, and you're going to see if there are any skin changes. You're going to lean forward to see if your nipples change in appearance or your breast tissue changes in appearance. And also you're going to raise your arms over your head, because depending on the size of your breast, you may not be able to see the underside just by standing and looking. You're looking for, like I said, skin changes, whether your skin is retracting or puckering or pulling in, or it's showing signs of dimpling. So now that you've done the standing part, and you're going to start to palpate, and you're going to use these 3 fingers, okay? Those are the ones that you're not going to use your palm, you're going to use your fingers to try and check for superficial lumps, and then you're going to press a little bit harder and check for deep ones. You're going to lay flat on your back, and you're going to make sure that you're using the arm so the arm where you're checking your breast, you're going to keep that arm, you're going to basically use the opposite hand for the breast that you're checking. And you're checking also your underarms, because like we just demonstrated before, your lymph nodes are under um, under your arms, so in your axle or armpit, you need to check there. You're also going to check for nipple discharge. So a bloody nipple discharge is of concern, but you also must keep in mind that there are benign things that may cause a bloody nipple discharge, but it's not something that you should ignore. So signs or symptoms. So once you've felt a lump, what do? This is a reason to call your doctor, but every lump is not cancer. If you notice a change in your breast size or shape of your breast, the dimpling or puckering that we mentioned before, the nipple discharge, the scaly, red, dark, or swollen skin, and that's consistent with inflammatory breast cancer, and swollen or enlarged lymph nodes. So those are things that you want to look for. So the things I can't control. You can't control your family history of cancer. You can't control your elevated lifetime estrogen exposure. So what does that mean? So for women who started menstruating before 12 and stopped menstruating after 55, you're actually being exposed to a higher level of estrogen in your life. And for women who have not had children, you're also being exposed to a higher level of estrogen because you never had that break from your menstrual cycle or with breastfeeding. Women who have dense breast tissue, you cannot control that either. So as we get older, our breasts become more fatty and less fibrous. So the concept of a younger breast tissue being more perky. So that's part of the perkiness, the fibrous nature of the breast. So with fatty breasts, when you look at it on an x-ray, it's just clear and black. When your breasts are dense on an x-ray, which is a mammogram, you will see white. And the issue is when you have abnormal cells or abnormalities on your mammogram, I should say, it appears white. So women who have dense breasts, if you've been told that you have dense breasts at the time of your mammogram, you should also have follow-up imaging, and usually that is an ultrasound. So if you're told, oh, your breasts are dense, they're always dense, and you're just getting a mammogram, that's something that you need to follow up on and ask for additional imaging to confirm that there's nothing hidden in the breast tissue. So other things that may increase your risk. So the issue with obesity, for some people, they try and weight loss eludes them. But the concern for carrying extra weight is that, especially in menopause, when your ovaries shut down and they're no longer synthesizing estrogen, the extra adipose tissue or fat tissue that is there under your skin also can synthesize estrogen and expose you to it and increase your risk for having cancer. So that is why it's encouraged for people to lose weight as best as they can. You also cannot control if you've had radiation to the chest for people who've had lymphomas. So those kind of things can increase your breast cancer risk. And consuming alcohol, we mentioned before, minimizing it is the best thing. Okay, so now that we've gone through these facts, let's talk about some myths. So one that's out there is that a mammogram can cause breast cancer to spread, because when you're having the mammogram, you can see, if you've had one before, your breasts are put between two plates, and unfortunately, they're pressed mercilessly in different directions. But this is not going to spread breast cancer. The breast cancer, if it's there, it's staying there. The mammogram is not pushing it anywhere. Another thing, I eat healthy. Breast cancer won't affect me. So while eating a plant-based diet does increase your health and improve your immune response, it does not take the risk completely away. So please do not ignore mammograms and breast exams because you're eating healthy and living a healthy lifestyle. Another myth that's out there, antiperspirants, deodorants, hair dye, all these things cause breast cancer. So the National Cancer Institute is not aware of any conclusive evidence linking the use of underarm antiperspirant to cancer. So this is something that I've seen myself in person on the internet, people passing things around. There's no current link. And breast cancer always causes a lump that I can feel. So as we mentioned before, with an inflammatory breast cancer being rare, it still can be a non-palpable cancer. So remember how to perform your exam. You're going to stand up and look, but also when you're laying down, you can go up and down, around, or towards the nipple. As long as you're covering the entire breast tissue, that's important. Okay. So And this is another myth. Carrying our cell phone in your bra can cause cancer. So it is not recommended that you carry your cell phone in your bra. And this is something that someone wanted to do to make life convenient, but at the same time, it's not ideal. There were 4 cases of women in the literature who developed breast cancer, but these women carried their phones in their bras for 10-hour workdays for many years. They had no genetic mutations or anything like that to make them at risk for cancer, but they all had their phone in the area that they had their cancer. So there's no research to say that this is common in the public, but at the same time, if you can avoid it, do so. But don't panic if you slip it there and all of a sudden think you're going to have cancer. This is not a common thing. And another one, only women can get breast cancer. So this is not true. As mentioned before, yes, women are 100 times at more risk for developing it, but men can also develop breast cancer. So it's important for men to check their chest wall as well. Menopausal hormone replacement therapy does not affect my breast cancer. So sometimes the symptoms of menopause can be so intense that women feel that I can take this and I can take this indefinitely. This is not true. Taking HRT increases the risk of breast cancer. The longer you use HRT, the greater your risk. Once you stop taking it, however, it can take up to 10 years for this risk to fall, about the same as if you had never taken it. And this will depend on the type of HRT that you were taking and the length of time that you were using it. Breast cancer risk is greater with the combined, so when using estrogen and progesterone, than with the estrogen alone. And so that is the take-home message there. And I know at a later date we'll be talking more about menopause and the symptoms and relieving the symptoms. At this time, we are going to take any questions.
Well, thank you so much, Dr. Olango, for that informative presentation. We really appreciate it. And then we do have a few questions here. So, for African Americans, there are certain forms of breast cancer, I think, that are more aggressive.
This is
Uh,
true.
right? What types are those again?
So if we can go back to the slide. So basically the slide that I meant had shown earlier, we mentioned that the triple negative breast cancer is the one that we find more commonly in African American women, and it typically happens before age 40. And that's very aggressive.
So, are there new recommendations for those women and how they do their mammograms
So
under
definitely
40?
So definitely you would talk to your gynecologist because he or she would be your biggest advocate, and it would not be unreasonable to ask for it at 35.
Oh, very good. And then regarding that, we had another question. Let me see if I can find it here on the mammograms. How often do we want a mammogram? What is the recommendation now for those at 40, or do we start at 50?
So the recommendation, it depends on which body of which which organization you're going under. So you can find it in the literature where they recommend that you have your mammogram starting at 40 and have it annually. So then the Cancer Society says have it annually starting at 40. And there's some bodies out there that say, well, it's less common before 50, so have it every 2 years. So in practice, I do it every year. I don't skip a year. If someone skips a year because they didn't come in, that's their prerogative. But if you're seeing me every year, I'm ordering it every year starting at 40. And back to the other question that you had asked about getting it before age 40, be aware, and some of you know, that it may be an issue with the insurance. So it's a matter of the doctor pushing for the patient, if possible, to have it before 40, because insurance companies have their guidelines. They don't see people, they see numbers and risks analysis. And so the likelihood of a woman having cancer before 40 is lower to them. So they kind of push back when you request an ultrasound, or excuse me, when you request a mammogram before age 40.
So then here is where we want to know our family history, right? I think on
Correct.
one of the slides you were mentioning, that if we have skin cancer, prostate cancers in the family, ovarian, then the risk for breast cancer goes up. I think that was BRCA2.
Correct. So with BRCA2, the melanoma, yes, the melanoma, the pancreatic cancer, so your risk does go up. So if it's in your family, there are lots of genetic testing programs that are out there where people can get tested to see if they have any mutations.
Very good. So, and I believe those are the most aggressive cancers, BRCA2 and triple negative. So then we would want to know our family history so that we can
Correct.
be more forceful on how we get those mammograms, make sure we get them every year, that kind of thing. Now, I heard a myth where the mammogram itself can cause cancer from radiation. What are your thoughts?
So you are exposed to radiation when you have a mammogram, and the exposure is small. And so the community of people that are concerned about lifetime total exposure from mammography, no, the risk is actually very low. You're at more risk for having problems with undetected cancer um, if you don't have a mammogram. So you can basically catch it earlier versus waiting and then ending up being further along and not being diagnosed properly. I mean, having a delayed diagnosis, I should say.
Right, with a poor outcome. We wouldn't want
Correct.
that. And so then in your practice, do you find that our African American counterparts, do they come in for their mammograms? Do they delay it? Um, how do you find that in your practice?
So actually, in my practice, my African American patients, they are very support. They get their mammograms. I find that there may be more push. It's very rare I get pushback from them. I would get more pushback from some of um, my non-African American patients because they've read things online, and it's not just them. There are things everywhere, especially in California. So, for example, there's something called a thermogram. It's
Mhm.
a type of imaging that's used to detect heat changes and blood vessel activity in your breast. And in Northern California, there's a big push for it, and there are people who are saying that it detects things better than a mammogram. The issue with the thermogram is that actually it is only 43 to about 80% effective at detecting things, whereas the mammogram is 82 to about 92% effective at detecting things. And so with the thermogram, they're saying that cancer cells grow rapidly, so there's more blood cell activity, so that's why we work better. But other things can cause blood cell activity too. So that's why the thermogram right now, the FDA says that it can be used, but it cannot be used by itself. So thermograms are something that people outside of the African American community often push, but it's not recommended at this time as a standalone method of testing and diagnosing.
I've actually seen a thermogram done, and as you said, it picks up the heat. So the
Yes,
patient was too hot; everything was red. So
right.
there's these little issues with the thermogram where the patient needs to be at the right temperature.
Temperature
If you're
correct.
dehydrated, right, you're too hot.
Hmm.
So yes, like you're saying, it would have to be used in conjunction with the mammogram in order to get the most accurate diagnosis. Let's see, and then we had another question here regarding hormone replacement therapy. How often or how many years would you say would be safe, for those who are really suffering with these hot flashes and night sweats? How many years would they be, can we say, safe to use it before they need to stop?
Ideally, at year 5, you should be thinking of weaning off of the hormone replacement therapy. And it's actually it should be an individual decision. So, for example, if a woman went into menopause at age 40 because she had surgery and everything was removed, there may be more leeway, but she has to know what her risks are if she's going to go down the road of continuing it for longer. So those women tend to have hormone therapy for longer. But if it's your average woman who has gone into menopause around age 51, 52, 5 to 6 years in, then she should be considering coming off of it. For women who've had their hysterectomy, they can be on estrogen alone. And so they would have to discuss it with their doctor how much longer they want to stay on it because um, the literature says that there's less of a risk if it's just estrogen alone. It's when you're on estrogen and progesterone. that your cancer risk goes up.
Oh, excellent, excellent. And then we have another question here regarding BRCA1 and 2 testing.
Mhm.
Uh, when should it be done?
It can be done at any time in a woman's life if they're a risk in the family.
Okay. And I
My
think,
youngest, yeah, sorry.
yeah, go ahead, go ahead.
My youngest patient that tested positive was 21 because of her
Wow.
family history.
Wow, that is young. And when we say family history, are we talking about immediate family, the sisters, the mother, or are we talking about cousins on dad and so on side?
It could be all of the above. So if there's several, if you're, so your first degree relatives definitely are very important. But if you have a grandfather and two uncles who've had prostate cancer and an aunt who's had um, who's had ovarian cancer and your mom has had breast cancer, that's still important.
Right, right. Oh, so very good. So it's good to stay together as a family and learn our family histories.
Correct.
Very good. So then we had another question here. Let's see. How can we encourage the women to get more mammograms? What would we say to women who are resistant to getting mammograms because they fear the pain of a
Of the
mammogram?
mammogram?
Mhm.
Well, one thing I tell people is that there are things that we can do to prevent ourselves from being a statistic. Finding things earlier prevents you from being a statistic, or for someone saying, "Oh, I wish." Regret is not a place to that is not a fun state to be in. So it's better to find out and then deal with it versus having regrets later on because you can't change it once you've gone past a certain point. So I try to focus on the regret part. And for the women who are afraid of the pain, I let them know that there are many things in life that are painful, but it's not going to kill you. And so it's not deadly. It hurts and it's temporary, and you go on. You go to the dentist and you sit there for a long time and get things done to your teeth. And with a mammogram, it doesn't take as long as going to a dental appointment. So you can do it.
Yes, that's a good one. That's a very good one because a lot of women they fear the embarrassment of having to take their clothes off. They fear the pain. But you're right. You know, there's not a lot of other things in life that are far more embarrassing. You just have one person there with you. And there's
Mhm.
definitely more things that are painful, like childbirth, for one. So if you've delivered,
Correct.
you can definitely get a mammogram because that
That
is
is
much
correct.
less. And then I believe we have these new mammogram machines that do not
Correct.
press as hard also. So then we can and one other comment I wanted to make was on husbands.
Mhm.
I had a patient at one time that came in and said her husband said that she had a lump in her breast. But she said she didn't feel any lumps in her breast, but the husband kept insisting. So she was there just to make him happy. Sure enough, we found that she had breast cancer, but it was because of her husband. So, women, your husbands sometimes know your breasts better than you do. And so, if they're saying that it feels differently, they find a lump or something is not correct, it's always a good idea to get that checked out. And so I wanted to go back to the slide of with family history. And did not get the one on BRCA1s because I think BRCA1 is the most common type of breast cancer. Is it in the nation? And there was
BRCA1, no.
BRCA1. I don't remember.
No, no, no. So the hereditary cancers are only about 5 to 10% of the cancers. The ductal cancer is the most common cancer.
Ductal.
It's
Okay, and that's the
ductal
one that,
cancer.
and that is the one that we do not feel a lump with.
No, so inflammatory breast cancer is the one
Mm.
where you don't feel a lump because it's involving the lymph glands. Basically, the skin gets very red and inflamed.
Ah, very good. So all the rest have lumps with them.
For the most part, unless they're pretty early and you're just picking it up on a mammogram, you will find you'll have a palpable mass.
Ah, okay. So very good. So then our one of our takeaways is that the majority, 90% of women will not have a lump, right? It's only 10%. No, no, I'm sorry. The majority of the women will not have a hereditary breast
Correct.
cancer, and the majority will not have any family history of breast cancer in the family. Is that, did I get it right?
Correct. Correct. The
Okay,
majority,
very.
the majority of women will not have a hereditary cause for their breast cancer. The number one risk factor is being a woman and getting older. That's it.
Ah, okay, very good. And now, and when you say older, is that the 50 and overs that are most common for breast cancer?
That is correct. But the women who are under 50 should still be aware.
So still be aware, right? And they should still
Yes,
get their mammograms done because it's
correct.
always better to do that earlier than find out when it's too late and we need a lot more interventions. And I did have a question there on interventions. Um, some women fear getting their mammograms done because if they find a positive and they do have breast cancer, they fear the treatments and the mastectomies that come after that. What can we say to encourage them on treatments? How are the treatments these days?
So there are many treatments. It depends on the stage of cancer where you were diagnosed. And if you're found to have it early enough, there are breast sparing options. For some people, no matter what stage they're in, they feel like they should remove their breasts, and that is your personal decision. You can make that decision with your breast surgeon. However, breast sparing surgery is available, and you'll find that many of the breast cancer surgeons now are women, and they would be doing things that are pro women's health and would not want to leave you scarred unnecessarily. So I don't want you to be afraid to get taken care of. And if you're not comfortable with a male provider, seek out a female breast surgeon.
Right. So if you're not comfortable with one, then look for more. There's always an option for you.
Correct.
Oh,
And get
that's
a second
wonderful.
opinion. Get a second
Yeah.
opinion.
Yeah, that's wonderful to hear that we have breast sparing interventions out there because we always think that, oh, once they diagnose us with breast cancer, that's it. We will lose our breasts right then. And we
No.
as women, sometimes we put a lot of identity into our breast. Oh, so that's very good to know. Now, I understand that in some cases, if we know that we're going to have a mastectomy and that we think that we are going to want implants for that, those things can be done at the same time as the mastectomy. Do you have any thoughts on that?
So in certain situations, you can have your reconstructive surgery at the same time as your mastectomy. However, you and your breast surgeon will discuss that because you'll have to have a plastic surgeon who is ready and on hand at the same time. So depending on where you live, well, I guess in the Southern California area where you are, you're more likely to have access to a plastic surgeon and a breast surgeon. In some rural areas, that's not possible. So they may not have it at the same time, but definitely ask if that is an option for you. Because if it is, then you'll have surgery once and be done.
Oh, yes, that's wonderful. So, ladies, yes, let's be proactive. If we're there in the surgeon's office, let's ask for it because sometimes it's not offered. You know, there's so many things that are happening at that appointment that it may get overlooked. So, if we're asking for these questions, then they're able to answer that, and then we will be able to make more informed decisions. We have another question that came in that states, what other diagnostic testing is needed with mammogram? If I understand right, you said mammogram is not a standalone test.
So if someone has a thermogram, the thermogram is not a standalone test. It would have to be accompanied by a mammogram. For women who have dense breasts, the mammogram is not a standalone test. If your breasts are normal and they're not very fibrous, then so as we age, our fibrous tissue, the perky part of the breast tissue, is replaced with fat, and so fat is more see-through. So on the earlier slide, I mentioned that if you have dense breasts appear white, whereas fatty tissue just appears see-through and black on a mammogram. when you have abnormal cells or abnormalities on your mammogram, they also appear white, so they can be masked by the dense breast tissue. So that's why if you're told that you have dense breast, you should ask for an ultrasound to confirm that there's nothing hidden within the dense breast tissue. So a mammogram
I
by itself in a normal person who does not have dense breasts is okay. For dense breasts, you need something more.
Okay, so a mammogram and an ultrasound for dense breast. So that most likely is the case in a lot of our younger population. And then mammograms alone are also okay. And then with thermograms, then we need a thermogram and a mammogram for complete testing. So
Correct.
correct. Oh, very good. So then we understand that. Then I wanted to look back at the slide regarding how can we prevent our risk factors. And currently, the only one I'm remembering right now is alcohol. But I believe there's also smoking. So we don't want to smoke, correct, to help us
Correct.
prevent
I'm
with the
trying to
breast
find the
cancer.
slide. Okay, so we're talking about this. Were you talking about this slide or a different slide?
Yes. I think it's, yes, this one. And so then um, the things that we are able to do to help us to be healthier, the things that we will share with our family members and our friends is these things here, right? Alcohol
Correct.
with women does increase your chances for breast cancer quite a bit, actually. Breastfeeding does lower that chance, right? And then we
Correct.
have those healthy babies with the good brains, right? With the breastfeeding. So we want to
Correct.
breastfeed for at least a year, isn't it? Is it a
That's
year? Or is
true.
it 15 months? Is it a year?
A year
Okay.
a year is ideal.
A year is ideal.
If you can go
Perfect.
longer, then go for it.
Okay, no problem. Now, I had heard that after 15 months or 2 years on breastfeeding, there wasn't that much of a nutritional value. Is that true?
Yes, they're not getting when they're breastfeeding past 12 months, actually, it's more so for comfort because they're eating
Right.
food by
Yes, yeah. So that's more mom and baby or bonding,
correct.
but really that first 12 months is imperative. So we try to encourage our women to breastfeed because it does help you with your risk of breast cancer while helping your baby to be healthier and very nutritional value. And then also, I think there was maintaining that healthy weight. Now, regarding the weight, you had said that the fat tissue somehow increases our risk for breast cancer. Can you clarify that a bit?
Yes. So hormones, our sex hormones, estrogen, testosterone, our sex hormones are fatty hormones. They're made from fat. And so fat is the building block that they need. So in women who are overweight, your extra fat cells that you have, your adipose tissue, is actually synthesizing a form of estrogen. And
Oh,
that
mhm.
can stimulate your tissue. And also, you'll find this is an aside from breast cancer. Women who are overweight are at more risk for having uterine cancer because that extra estrogen is actually stimulating the lining of their uterus when the uterine lining should be dormant because you're not having babies anymore.
Oh, wow. So that extra fat then is making its own estrogen plus the one that our ovaries are making?
Yes, but after when you're in menopause, the ovary has shut down, so it's the peripheral or your own fat cells that are forming estrogen.
Mhm. And that can increase also a risk for uterine cancer.
Correct.
So then, with belly fat, is that also increasing our risk then for uterine cancer?
It's fat is fat. So belly fat it's
No, it's fine. I say that because we sometimes have these women that are really skinny, skinny legs, skinny arms, and then
oh, I see
all
what you're
the
saying.
fat is
In their
only there
belly.
at the belly, and so they call it the belly fat.
Okay. So
Yeah.
though carrying it around your waist increases your risk of heart disease, it's unfortunate because when people are overweight, it does get tiring to hear it's because this is because of your weight and that is because of your weight. Your weight does affect many things in your in with affects many things in regards to your health. So the goal is to strive to be your healthiest self and be your healthiest self.
Yes,
You don't
yes.
have to be a size 2. You actually have to strive to be your healthiest self, not just say, this is the way I am. Genetically, everyone in my family is big boned, and I've heard that too. But at the same time, but are you your healthiest self?
Oh, very good. I like that phrase, your healthiest self. And so that brings in mind that even if we are overweight, and even if the weight is not coming off as fast, if we would be our healthiest self, meaning that we're exercising every day for a minimum of 30 minutes, right? 5 days a week. If we're
Correct.
doing that, if we're adding vegetables to each meal so that we can at least come close to totaling 4 cups a day, right? All these things help us to be our healthiest self, even if we're still a little bit on the plump side, right?
This is true. So something that I tell my patients at the time of their annual exam, because there are no perfect people, so things that we can do to while we chase after perfection. You can do smoothies, you can do salads, and you can do soups. And I tell them to do at least 2 of those a day as their minimum. And then if they know that that's their basement, then if they have more than that, then that's fantastic, because typically you are having more than one blueberry in a smoothie. When you make a smoothie, you know, you're putting multiple things in the container in your salad. You're going to do it. A cheat for women who are on the go and busy is to get the
Mhm.
prepackaged salads, but do not get the Caesar, the ranch. You can do the vinaigrette yourself, or you can buy the ones with the Asian vinaigrette. So it's a goal towards perfection. Is it perfect? No, but it's still easier than going to buy a salad at McDonald's. You can buy a prepackaged one at the supermarket and get get lunch and dinner out of that prepackaged salad.
Exactly. And now I know some women will say that the prepackaged is too expensive, but the way also to think about it is if you're not going to eat any salad at all because you don't have the time, it's
Correct.
better to put your money to keep yourself healthy so that your
Correct.
future, we can stay away from breast cancer and all the other diseases that come along as we age. Those are
It,
some.
that's
Mhm.
important, and something that I do know because of human nature. When you do get told that you have an unfortunate diagnosis, suddenly things aren't as expensive as you thought that they were. So it's
Right.
better to invest. And so instead of thinking of it as an expense, think of it as an investment in my health. And so the prepackaged salads are $3 or less, depending on which supermarket you go to, versus on the other side of it, all of a sudden you're having to take time off of work, which is going to cost more than $3.
Exactly. And these things do affect the entire family, taking time off work. You have
Correct.
your kids, the husband, any
Mhm.
parents that you might be taking care of. So it affects everyone. So, yes, we do want to be the best selves that we can be. And
Mhm.
then I wanted to let the people know, at least for California, and Southern California, there are programs to help you with free mammograms, such as the San Antonio Hospital right now for the month of October, but they have extended it to December. Will be offering $50 mammograms, of course, with an order from your doctor. For any woman who comes to them, they've had a decrease in mammogram use and the preventative services due to the COVID-19 pandemic.
Mhm.
So, just to let the ladies know that at San Antonio Hospital, they can get $50 mammograms with an order from their doctor. Because, of course, they need to be able to send the results to a doctor
Correct.
there. Yes. And then in California, for the state of California, we do have a program called Every Woman Counts. And that program, if you meet the financial qualifications, offers free mammograms and the treatment to their women who qualify. So they'll take care of all your mammograms, the ultrasounds, the follow ups, and any treatment. I think for the treatment, you actually go into a different program, but you
Mhm.
do start with the Every Woman Counts program. Then also you have the Susan G. Komen program that one I believe is national. And so then you can also contact them, apply with them as well for mammograms, but they also do your support systems. They help you navigate the system. And that is so important when you get such a diagnosis. It's so overwhelming that they do have support for you. I think we also have the United for the Cause Foundation. They also do support for you, questions that you might have to help you navigate your appointments as well. And then, as far as donations go, what we as individuals can do to help support those with breast cancer, to help family and so on, we do have the Pink Ribbon Place there in Riverside. It's a thrift store. But what they do is they take the money that they gain and they help you with the wigs and augmentations and things like that. And support the family as well. And they see what else that they can do. So that's a good place where we can donate, especially our gently used clothing and things like that, that we want to clean out our closets and buy new
Mhm.
things. We can donate there to the thrift store with that. So those are the resources that I have. Oh, we have one other question that has come in here. At what age someone would qualify, I believe, for the Every Woman Counts program? And the age qualifications, if I'm remembering correctly, is at 50. They do not do the younger women under 40. That unfortunately would have to go through your insurance and through your physician. But at age 50, I believe they start their program. It might actually be age 40. So please check online. A lot of women do qualify for that program, the Every Women Counts. And you can Google it. They have different clinics in different areas. So you need to find out the area that's closest to you. And I see a response here is age 40 that you qualify there with the Every Women Counts program. All right, Dr. Olango. So then next time we will hear from you regarding menopause, you were saying.
Correct.
Yeah, so menopause, the next chapter. That sounds exciting. You know, we're going to want to hear a lot of what we're going to do to help prevent those symptoms that comes with menopause, all those hot flashes and night sweats. I hope you're going to talk a little bit about those mood swings. I'm sure the
Yes.
husbands they want to hear what can we do about those mood swings and the sleeping problems. But we thank you so much,
You're
Jacqueline
welcome.
Williams Olongo, for being with us today and giving us such important information on breast cancer awareness. Please, everyone, share this on your pages, on your social media pages, so that we can get the word out to our women everywhere and our men, because the men also, you have some of the same symptoms. And so if you feel alarmed, please also go to your doctor. Don't just think it'll go away. Just go on to your doctor and get it checked out for our men as well. So we thank you so much for bringing that out for us, that the men can also get breast cancer as well. So we want to thank all of our viewers that stayed with us for this session. Tracy, we see Louise, Maria, and Delia. We thank you so much for supporting this presentation on breast cancer awareness. Let's pray us out. Do you have any final comments, any takeaways for us, Dr.
N-
Olongo?
No, just be your healthiest self.
I love that one. Be your healthiest self. Do what you can do. And if you fall off the wagon, get back on. So, I had ice cream yesterday. But today, no, I'm going to get back on that wagon, right? And get
Mhm.
my vegetables in. And the exercise, that was the other thing I had wanted to mention, how important aerobic exercise is to
Mhm.
the breast. So for us not to forget the exercise part. Thank you so much also, Doreen, for being with us. Let's go ahead and pray. Father God, thank you so much for this fabulous information, this powerful presentation, and how we can best improve our lives and those around us by sharing this information. Please be with us as we go on with our day. Bless everyone here that came to listen to this presentation, and bless Dr. Alongo as well. In Jesus' name I pray, amen.
Amen. Thank you.
You're welcome. Thank you so much.